Hey, Middle Tennessee. I am Daniel Adams, and I'm here with Dr. Kent Lofley at Blue Ocean Family Medicine. How are you, Kent?
Doing great. How are you today, Daniel?
So good. What I'm excited to talk about today is what most Middle Tennesseans don't know about health insurance, which is kind of a big deal for a lot of people. So, let me ask you this. How is Blue Ocean Family Medicine different from other family medicine practices?
Yeah, great question. So, first off, we don't bill any health insurance. So, I'm a firm believer in that whoever is paying me is who I'm working for, right?
Mm.
So, if the insurance company is the one that's paying me, then they get to kind of have a say in what I'm doing, the decisions we're making. And I don't want them in the exam room dictating what we're going to do as far as healthcare.
Both how you work and both what kind of care the patient is receiving, yes?
Correct.
Like
It's
the
it's
the
both.
insurance company doesn't get to dictate what happens with my wife and my 11-year-old son. You're saying
Mhm.
like let's just cut the insurance middleman out of it.
Yeah. So if we get rid of insurance, we get rid of their rules and regulations and requirements. And that allows us to have the freedom to have like a conversation between me and, if you're my patient, you, to decide what's best for you and your wife and your kid without any other bureaucracy. And then the other part of it with insurance is insurance does not guarantee that you're going to have great healthcare. It's a payer for your healthcare, right? And so since they're paying for the healthcare, they get to decide what they're going to pay for and what requirements there are for them to be able to pay for whatever service it is. And so if you have them out of the picture, then they're not deciding what care or what studies you're getting done or what treatment you're going to do. That's just a discussion that you're having between you and your doctor to decide what's best for you and your family.
And that's one of the things I didn't understand when we were on our health insurance plans because we'd submit and say, hey, we'd like this covered. And they're like, oh, we don't cover that. And it's like, well, what in the world am I paying you for?
Yeah. Yeah. So it just gives you the opportunity
Yeah.
for them to pay for what's included in your plan.
Like it really
Uh,
did inform like, oh, well, like there were four options we were interested in, but insurance would pay for one. So it was like,
yes.
okay, well, we get to now get this specific treatment because that's what insurance will cover.
Yeah.
So I can see there's so much wisdom in, well, if we just cut the insurance out, like now I have full accountability, responsibility, and opportunity to pursue whatever treatment that's going to serve me the best. That's going to create the best outcome for me and my family. That's brilliant.
Yeah. It really opens up transparency. I've worked in the other system, right? I've been practicing medicine for over 10 years now since I've completed my residency. And I've worked in the system where we're paid by the insurance company. And I wasn't able to have really good, transparent conversations about cost or treatment options with patients because I didn't know how much it was going to cost them, right? That would come up in the conversation.
that's
Like, I
that's later
suggest,
down the road.
yeah, it's like, I suggest that we go do this. And patients asking me, well, how much is it going to cost if I go get this MRI of my shoulder? I'm like, well, I don't know how much your insurance charges you, what your copay is for that, right? In the practice I'm doing now, where we're not billing insurance. If people have insurance, they can use it to go and get an MRI or pay for meds at the pharmacy or see a specialist. But if they don't have insurance or they just want to pay a transparent cash price, I work with imaging centers who tell me the cost for this image, this x-ray, this MRI is this much. And then we can have a really open, transparent conversation. If you want to do this test, this is how much it's going to cost.
And there's no inflated, because I received my bill once from insurance that was like, you received your blood work and vitals and it was, $396.12 and insurance covered, $236 of that. And so here's your part. And it was like, whoa, like I was in there for like 15 minutes. Like who decided that was the rate?
Yeah. Yeah. And so I think people don't realize how inflated healthcare costs are, uh, partly because of the insurance system. because the hospital or the physician's office is wanting to get paid a certain amount, and they submit their bill, and then the insurance company negotiates and tries to haggle down the price of how much they're going to pay.
Like, oh, we're only going to pay 80% of that, or we're only going to pay
Yeah.
60% of that, or we don't cover this service or that service or these labs or.
Exactly. And so what has the healthcare system done in response? They say, well, if you only pay, 20% of my bill, then I'm just going to raise my price.
That's the first rule of bartering, right? Like you got to
Yeah.
start high so you can negotiate down to the middle. That makes sense. So essentially part of what's jacked up both insurance premiums and health prices is this kind of argument between health insurance going like, yeah, we're not going to pay for that. So the hospital just says, well, we're going to ask for 10 times more. And even if they do talk them down, it's still whatever. But then that gets passed on. The risk of that, right, gets passed on to me. And I get to bear the brunt of these two entities battling over what kind of care they think I should get.
Exactly. So if you can just get rid of the middlemen from that situation and have a transparent price, you can bring the price way down.
So now it's just me talking with Dr. Lofley about the best option for my care and for my kids' care and for my wife's care.
Exactly.
And it's transparent. You know exactly how much it's going to cost. You quote me that, and then we can talk about it.
Yeah. Yeah. That's the whole idea of doing this, where even if you have insurance, you can save money going to see a direct primary care doctor where you just have this known rate that's transparent.
That's amazing. And I did hear you say, like, if my work has health insurance or whatever, I can still use that. Even if I come to Blue Ocean Family Medicine, like I can have both.
Yeah, absolutely. So about half of the patients who come to Blue Ocean Family Medicine have health insurance. And so you can still use your health insurance to pay for medications at the pharmacy if you want to. You can use it to pay for laboratory testing. You can use it to go to an imaging center or see a specialist. Or, if there's a big emergency and you need to go to the emergency department, then you have health insurance for those type of things. But for primary care services, basic medical maintenance, preventative care, you don't have to worry about the insurance and you can actually save money.
That makes sense. And it's attractive to me. What kind of services do you offer as a primary care physician?
Yeah, so really, as a primary care physician, I'm trained to handle the majority of medical conditions, right? So typically in a family medicine office, we can handle 80 to 90% of someone's medical complaints. And then there are, 10 to 20% that would need to see a specialist or needs to go into the hospital, those type of things. So acute care, if someone is getting sick with a cold or sinus infection, ear infection, sore throat, bronchitis, pneumonia, anything like that.
Y'all do strep?
Ankles. Oh, yeah. Yeah. You can come in the office. We can run a strep test. We can run a flu test. We can check a urine test or urine pregnancy. All of that is available in the office as part of the membership. If someone has a joint injury, we can look at that for sprains. We can send someone for x-ray. So any type of acute type of visit, we can handle a lot of that. Obviously, if it's more of an emergency where you're having a heart attack or stroke, those type of people need to go to the emergency room, right? But a lot of other things we can take care of in the office as far as acute care.
If my kid broke his arm and I can clearly see that he broke his arm, where does that land?
No, that's a great question. So if you can tell that there's a broken arm and the bone sticking out of the skin, right, that needs to go to the emergency room.
Gotcha.
If it looks like there's a broken arm, you can absolutely reach out to the clinic. We can get you in for an x-ray, see the severity of it, potentially splint it. If they need to go and see an orthopedic surgeon in a couple of days, we can do that. If it's not that severe, then we can take care of it in the office.
I know more and more people too have been talking about IBS and Crohn's and celiac and like all sorts of like gastrointestinal things going on? Are there things that Blue Ocean can help with that?
Yeah, so in addition to all of the acute care type of things, we do chronic type of conditions, right? And so you mentioned a bunch of gastrointestinal conditions. Absolutely, there are different treatments that you can do for that. We can talk about initially looking to see if there are dietary things that could help improve those symptoms. So there's dietary lifestyle changes, and there's potentially certain over-the-counter supplements that can help with some of those symptoms. And then there are things like medications that sometimes are necessary to help with some of those symptoms when it comes to gastrointestinal type of illnesses, and do help prescribe those type of medications too.
So
And
there's
then sorry, go ahead, Daniel.
So there's a full complement of services, like a lot of things it sounds like can be covered by meeting with Dr. Lofley in the office in Hendersonville.
Yeah, absolutely. And other common chronic medical conditions that we see every day and we help with: diabetes, high blood pressure, high cholesterol, asthma, all of those kind of common chronic medical conditions we take care of in the office every day.
Amazing. And what were you sharing earlier?
Oh, I was just going to say that there are all of these other type of chronic conditions that we can manage in the office. Yeah.
Well, it sounds like an amazing service that's super personable, really flexible, highly transparent, super relevant to what is going on in our families. If I want to enroll my whole family, like what kind of cost are we talking about? It seems like it'd be really expensive to have all this in one place.
Yeah. So an individual, it's $65 a month to be part of the practice. And I understand like everyone's kind of pinching their pennies and wanting to make sure they're getting the most out of their dollars. So for families, the most I'll charge is $260 a month. So if you have a family of 4 or more, there's no additional charge for each additional member of the family.
And that is, so if they sign up, and so let's say somebody joins the practice and they sign up and there's that cap per month, they can come in and get whatever service and it's just all covered. There's no copays. There's no like, it's $60 every time you come in. No, this is like, just like, there's just the enrollment.
Yeah. So for all of the primary care services that we offer, being seen for sick visits or a physical or sports physical or chronic illnesses, that's all covered under the membership fee.
Well, that's attractive. That's attractive for me.
Yeah, it's all kind of a fixed cost, right? You know how much it's going to be.
And I could just, so if I need a physical, I just call you up and I just come in. There's no copay, there's no whatever. It's just like, it's part of my membership.
Yes, absolutely.
Brilliant.
Yeah. The only additional cost would be other services we offer in the practice would be laboratory testing. So I contract directly with LabCorp. And so there is the cost of the labs. It's a highly discounted cost. So it's not uncommon for people to be able to get their kind of annual routine blood work for somewhere between $15 and $30.
I thought you were going to say $1,500.
Sometimes
I go in for labs, right? And they're like, "Oh, it's going to be $400 for your labs." And it's like, "Oh, I think I'll skip this year." But you just said like $15.
Yes,
like 1.5.
1.5. That's right.
And this is part of what you're talking about with the inflation of like, okay, if the hospital knows that the insurance is only going to pay out 60% of their thing, then I got to tell them it's going to be $700 so that they pay 60% of $700, and this is labs.
Yes, that's exactly what happens.
So I can see what's happening now if we cut out the middleman, and it's just like, oh, well, the cost of the thing's $15, and here's your data. Let's help you make a choice.
Yes. Yeah, so it's great savings for people as far as lab tests go.
Well, this is amazing. How do I sign up?
So you can go to blueoceanfamilymedicine.com. There's a place to schedule an appointment, fill out the initial new patient paperwork, and we can get you in and be seen usually pretty quickly for new patients within 1 to 2 weeks. Or you can call the office at 615-266-6465.
Well, there you have it, Middle Tennessee. An amazing opportunity to get the healthcare that is most relevant for you without some company you've never talked to telling you how to do it at a massively affordable price. Tell us that number one more time, Dr. Lofley, if they want to get in touch with you.
Yeah, you can call or text this number if you have any questions about the practice. It's 615-266-6465.
Amazing. Thank you so much for your time today.
Thank you, Daniel.